I'm Dr. Eric Gravois, family medicine physician with Thibodaux Regional out in Assumption Parish. And today I'm going to talk about 3 important topics related to men's health for Men's Health Month. The first topic I'd like to speak about is heart disease. Now, heart disease actually encompasses a number of different diseases, but what we're talking about today is mainly coronary artery disease. Now, heart disease is the main cause of death for most adult men in the United States. This crosses most racial and ethnic groups, and in actuality, 25% of all deaths are related to heart disease in adult males in this country. So what are the signs and symptoms of heart disease? Most of the time, heart disease actually can be asymptomatic and you can have no symptoms whatsoever. But oftentimes you do have symptoms. The one that everybody thinks about is always chest pain. But in actuality, you can have shortness of breath, decreased exercise tolerance, which is basically decreased ability to exercise compared to before, lower extremity swelling. You could also have some vague symptoms such as different gastrointestinal symptoms or upper back pain. The biggest point about all of this is that you just have to discuss with your physician some of the symptoms that you're having, which would then allow you to try to figure out what's actually going on. So what are the risk factors of heart disease? Well, the risk factors of heart disease actually encompass a number of things also. The main 3 being high blood pressure, diabetes, and high cholesterol. In actuality, 50% of adult men in the United States do not have adequately controlled blood pressure. Also, risk factors include obesity, poor dietary habits, and decreased exercise. Those actually go back into the hypertension or high blood pressure and diabetes, as well as high cholesterol also. One of the main risk factors for heart disease in this country actually is smoking. It's one of the main preventable risk factors they actually have. One of the number 1 risk factors, though, that people normally don't think about actually is family history and genetics. A good colleague of mine always said that you can't choose your mom and your dad. And it's important to think about that and talk about that with your primary care physician. What are the risk factors, especially when talking about primary relatives such as mom, dad, grandfather, grandmother, uncles, and aunts. If they had a history of coronary artery disease or stroke or heart attack at a younger age, you're at risk of this also. So what can be done to prevent this? Well, when talking about the risk factors, it's preventing the risk factors. So decreasing weight, increasing exercise, eating a healthy diet. The other thing is seeking help from your physician to discuss your risk factors and what can be done to prevent it. Things such as blood work that can test cholesterol, blood work that can check for diabetes, and things such as that. The second topic I'd like to discuss is prostate cancer. So what is the prostate? The prostate is an organ in males that sits below the bladder right in front of the rectum. It is involved in releasing fluid that is added to semen. As you get older, your prostate actually enlarges. This is a natural thing and is very common in men. Sometimes they have symptoms, sometimes they don't. In the prostate, sometimes cancer can develop. It's actually the most common cause of cancer in males in the United States. Approximately 15% of all adult males will develop prostate cancer throughout their lifetime. And out of these, about 2 to 3% of them will die. So what are the signs and symptoms of prostate cancer? One caveat is that some of these symptoms actually can be seen in a number of disease processes. So you need to discuss with your doctor some of the symptoms that you're having if you do experience any of these. And these are symptoms such as frequent urination, especially at night, trouble initiating urination, a weak stream, blood in your urine, blood in your semen, abnormal pains such as hip pain, pelvis pain, leg pain. Any of these symptoms could actually be due to prostate cancer. It can be due to enlarged prostate symptoms. It could also be due to a lot of different things. So it's very important that you discuss with your doctor these things. So what are the risk factors for prostate cancer? Well, there's 3 main risk factors for prostate cancer. The first being age. As you get older, your prostate enlarges and your risk of prostate cancer actually increases. It's actually very high risk as you're much older into your 80s and your 90s. Just like in heart disease, one of the most important things is family history. If you have a first-degree relative, such as your father, your grandfather, your uncles, either on your paternal or your maternal side, that have had a history of prostate cancer, either later in life or earlier in life, that increases your risk, and you should discuss this with your doctor. African American men have a 2 times more likely risk of prostate cancer than other races. They tend to develop prostate cancer at an earlier age, and they tend to develop more aggressive prostate cancers when first diagnosed. So, how do we screen for prostate cancer? Well, this is kind of a hot button topic that's developed over the years. PSA is a blood test that tests for an antigen that is released by the prostate. It was previously used as a screening tool in lots of different ages in males, but recently it's been kind of centered toward a certain age group and a certain population. The biggest thing is having a discussion with your doctor whether PSA is a good blood test for you. The USPTF actually recommends that adult males between the ages of 55 and 69 have a discussion with their doctor whether it's a good idea to screen with a PSA or not. It is not recommended that anybody over the age of 70 specifically use a PSA test for screening purposes. Now, if you're having symptoms or have a history of prostate issues, that changes, and that is a discussion you should have with your doctor. Previously, digital rectal exams were recommended in all adult males after the age of 40. Now that's actually kind of fallen out of favor, and the USPTF does not recommend digital rectal exams for screening purposes. Again, if you're having symptoms, that's another discussion, and you should discuss with your doctor. The third topic I'd like to discuss is mental health. Now, this is an interesting topic because this isn't something that you normally think about with men's health, but it actually is important nonetheless. So mental health covers things like depression, anxiety, bipolar disorder, focus issues. Women are much more likely to be diagnosed with mental health issues or mental health diagnosis than men. But also men are less likely to actually seek help or discuss with their physicians their mental health. Men are more likely to have substance abuse issues, and men are more likely to have dependence issues. Also, when discussing symptoms of mental health, such as anxiety or depression, men tend to have more vague symptoms: agitation, aggression, trouble with sleep, trouble with sexual health, trouble with appetite, vague symptoms such as generalized aches and pains that cannot be explained otherwise, generalized gastrointestinal symptoms that cannot be explained otherwise. So it's important that when feeling anything that you have a discussion with your primary care physician or any other trusted physician about some of the symptoms that you're having. So if you'd like to discuss any of these topics with a primary care physician such as myself, you can contact us at Thibodaux Regional at 985-369-6070.